Dr Murphy, thanks for your time once again.
Pleasure, Leigh.
At this point, as many of us start to take steps towards resuming whatever will pass for a normal life, what is the key to avoiding a second wave of infections and a return to full lockdown?
Thanks, Leigh. So I think the most important key to it is personal responsibility. Regulation has taken us a long way and Australians have really stepped up to the plate. But as we cautiously remove restrictions, every Australian has to behave responsibly. It's terribly important because the risk will increase at each level of reducing restrictions. We know that this virus is still in our community, and if people don't all do the right thing, do all the social distancing measures, avoid crowded places, do all the hygiene measures, that to me is the most important thing. If we're going to live with this virus for months in an economy which is more open, we have to change our fundamental way of human interactions.
Some of the political leaders have said that as we ease restrictions, we will see an increase in cases. How many national cases would you tolerate each day before you went into lockdown mode again? What is the ceiling?
So there's no ceiling. The critical thing about an increase in cases is the nature of it. If it's a localised outbreak, like the Cedar Meats outbreak in Victoria, where the public health officials can come in, contact trace and control it, or like the Burnie outbreak, they don't worry us. What worries us more is if you had a whole lot of pockets of community transmission, particularly if you didn't have clear epidemiological contacts identified. So it's really a whole suite of measures that we've put through the National Cabinet process that we're going to be monitoring. So it's total case numbers, it's that effective reproduction rate that you've seen, which is meaningful if you've got lots of cases. It's how quickly outbreaks are coming under control. It's how diffuse and widespread outbreaks are. So it's a whole picture that we would look at before being concerned. But our intention is to expect outbreaks, but to have, because of our really strong public health programs and our testing, to respond to them and control them without having to introduce measures again, if at all possible.
You mentioned the Cedar Meats case in Victoria, the abattoir. Is that something of a test case for seeing how well our systems are managing a localised outbreak?
Yes, I think that and the North West Tasmania outbreak in Burnie, where not only did they close hospitals but quarantine some thousands of staff, but also really locally shut down parts of the town. That was a very good response too. And the Cedar Meats is on a smaller scale, closing down a workplace, quarantine a lot of staff, but also testing widely. What we've learnt now is that if we really test every contact and very aggressively test, we can find cases earlier and respond more quickly. So both of those are good test cases.
How many people have now signed up to the COVID Safe app, and how long will it be until it's working as intended?
So it's a bit over, I think it's about 5.5 million today. I haven't seen an update in the last few hours, but it's increasing every day. And at the moment, that's about a third of the 16 million adults with smartphones, and I believe that some of the states and territories are in the final phases of their training and testing, so they should be able to get data out of it this week.
What at the moment most worries you? If you wake up in the middle of the night, what's the thing that most plays on your mind?
Oh, a large second wave. That is the most worrying thing of all. If we saw people behaving really badly and congregating, we've seen that this virus is incredibly infectious. We saw 35 people from one wedding, in the early phases. It can spread really quickly, and if people aren't careful, and we have lots of pockets of outbreaks and widespread community transmission, thousands more cases, that is what worries me most of all. I don't think it'll happen because I think we are as well prepared as we could be, but it'll only work if every citizen does the right thing. And I just say again and again, it's those of us who are mobile, fit, adults that are the people who probably don't get sick with this virus, but we're the ones who transmit it, and we've just got to all be so careful.
Dr. Murphy, thanks for your time.
Pleasure.
Hi, I'm Leigh Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.